This video presents high-yield psychiatry cases for medical students preparing for exams such as the USMLE. Each case focuses on key clinical concepts, diagnosis, and important distinctions that are commonly tested. Case 1. A 30-year-old woman with a history of major depressive disorder presents with concern that her depression is returning. She reports decreased appetite, poor sleep, difficulty concentrating at her job as a teacher, and social isolation. She has access to both new and old medications at home. She has no personal history of suicide attempts, but her mother died by suicide at age 40. The question is, what is the most important factor in assessing this patient's suicide risk? The correct answer is access to medication. Suicide risk assessment is based on evaluating ideation, method, and intent. Suicidal ideation can be passive, such as wishing to die or not wake up, or active, such as thoughts of killing oneself. The method includes thoughts of a specific plan, access to means such as medications or firearms, and the lethality of the method. Preparation includes actions such as collecting pills, obtaining a weapon, giving away valuables, or writing a suicide note. Planning involves specific details such as time, place, and method. Intent refers to the strength of the patient's desire to act on these thoughts and the time frame. In this patient, although there are multiple risk factors, the most concerning feature is preparation, specifically collecting medications with a potential plan for overdose. Hospitalization may be necessary to ensure safety. Case 2. A 21-year-old woman presents with constipation and abdominal pain. Review of systems reveals irregular menses and occasional fatigue. She smokes 1 pack of cigarettes daily and drinks alcohol socially. Vital signs show hypotension and tachycardia. Physical examination reveals dental enamel erosion. The most likely diagnosis is bulimia nervosa. This patient's findings are consistent with self-induced vomiting, including electrolyte abnormalities such as hypokalemia and metabolic alkalosis. Additional findings may include calluses on the dorsum of the hand, known as Russell sign, and parotid gland enlargement. Bulimia nervosa is characterized by recurrent binge eating followed by compensatory behaviors such as vomiting, laxatives, fasting, or excessive exercise. Patients are excessively preoccupied with body weight and typically have a normal or increased body weight. Symptoms include abdominal pain, bloating, constipation, lethargy, and menstrual irregularities. Case 3. A 40-year-old man is diagnosed with major depressive disorder and started on antidepressant therapy. After several weeks, his symptoms improve slightly, but he develops decreased libido and impaired sexual performance. He is considering stopping the medication and requests an alternative. The most appropriate medication is bupropion. Selective serotonin reuptake inhibitors are commonly used as first-line treatment for depression, but can cause sexual dysfunction in up to 50% of patients. These effects include decreased libido, anorgasmia, and delayed ejaculation. Bupropion is a norepinephrine dopamine reuptake inhibitor that does not typically cause sexual dysfunction. It is useful in patients with low energy and hypersomnia and causes less weight gain. However, it is contraindicated in patients with eating disorders and seizure disorders due to decreased seizure threshold. Stay tuned for Part 2, where we cover trauma-related disorders and key eating disorder distinctions with high-yield clinical insights. We will review how to manage antidepressant-induced sexual dysfunction and how to differentiate dissociative amnesia from other stress-related conditions. These are key concepts frequently tested on exams and highly relevant in clinical practice.